Hey guys, so this is now the cranial nerves video, so we'll talk a little bit about them, but we'll also go through how to evaluate all 12 of those. So yes, there are 12. Those cranial nerves control pretty much everything we do in terms of speaking, seeing, blinking, shrugging our shoulders, all of that. They can be either sensory, they can be motor, or they can be both. And I'll tell you which ones are which. I'm sure your lecture professors will also say however they do their lectures. All right, so the first one we have is the olfactory nerve, cranial nerve 1. So that one is a sensory nerve. So what you do for that one is basically you have your patient smell something. I don't have anything at the moment. Here, I'll use this. All right, so I got a candle. Okay, so not lit. But what you do first is you have them close their eyes and you slowly bring it towards them and have them let you know when they start to smell something. You can also have their eyes closed and they can tell you what they smell. Then we have cranial nerve 2. So cranial nerve 2 is also a sensory nerve. It is the optic nerve. So that controls your vision. So can they see? Typically that can be tested through, excuse me, that can be tested with what we call a Snellen chart, right? So when you go to the eye doctor and you have that chart in front of you and they have you cover one eye, that is what we do. If you don't have the Snellen chart, you can always have them read something to you far away or close up. So I'll have him read. I have a little PowerPoint up here, so I'll have him read the first line right there. So that's a little bit farther away. What does that say?
Optic.
Yeah, so it has the optic nerve on it. It says the word optic, cranial nerve 2. And then you can also have him read something closer up, so like the bottom of the candle. So just that top line.
Balsam and cedar.
Cool. All right, so then we have cranial nerve 3. So cranial nerve 3 is the oculomotor nerve. Hence, so there we go, tells you right in the name of it. It is a motor nerve. So it controls the motion of the eye, typically the eyelid, and what holds it open. It can also do some eye movements. So what you do for testing that is the it's called the smooth pursuits. So smooth pursuits can also be called the H test. You have them look at the tip of your finger and without moving their head, you move it up and down in an H pattern. And then there's another one that's the Z pattern, which we'll go over in another test. But also with the oculomotor, oh no, I'm sorry. Yes, no, also with the oculomotor, it will be the dilation or constriction of the pupil in the eye. So what you can do for that one, typically you have a pen light, which we had in lab, but unfortunately I do not have one. So what I'm going to do is I'm going to use my phone flashlight. I'm going to cover one eye, have him keep his eyes open, and all I'm going to do is shine my light in his eye, and I'm watching for his pupil to constrict when that light goes in his eye, okay? Don't hold your light in their eye for a long time if they have a concussion or something, it's going to give them a massive headache. So just be careful on that. So then we've got cranial nerve 4. So that is the trochlear nerve. That one is also a motor nerve for the eye. It does inferior and lateral eye movement. So again, with that, you can do that smooth pursuits test. So do the H and have them follow the finger, tip of my finger with their eyes, okay? Typically the down one and out to the sides, okay? Then we have cranial nerve 5, the trigeminal nerve. So that one is a mixed nerve, so it's motor and sensory. So the way that we can test that is the, have them clench their jaw, right? Because it's the muscles of mastication for the jaw. So have them clench their jaw, and then I'm going to just grasp right around and pull down for that. And then for the sensory part, we're going to test the sensation of their upper lip, their, and then it can also be their teeth. So you can have them close their eyes and you can test both sides of the face around the mouth area. We then have abducens or cranial nerve 6. So that one is another eye motion one, therefore it's motor. So that one is eye movement laterally. So if you guys remembered, for oculomotor, I said there was another way to do the smooth pursuits, and that is the Z pattern. So for the lateral movement, again, have them follow tip of your finger, lateral movement, and then you can do diagonal movement as well, and then go back up, okay? So then we have the facial nerve, cranial nerve 7. This one is a mixed nerve as well, so it is sensory and motor. For the sensory portion, it is the anterior 2/3 of the tongue for taste. And it can also be sensation on the outer ear. So if they can feel the touch on the outer ear, so I would have them stick out their tongue and I'd put a piece of gum on there or something like that. You don't want to put it in their mouth and have them chew it, just in case there's an issue with another nerve. So just that. All right, and then for the motor part of the facial nerve, how we test that is having them make different facial expressions. So for that, you can have them smile with their teeth, frown really big, scrunch their eyebrows together, that sort of thing. And then, yeah. So that's that for facial. So we're on cranial nerve 8, the vestibulocochlear nerve, fun word. So that one is a sensory nerve. It has 2 divisions. So there's the vestibular, right? Vestibular, which takes into account balance. So for that, testing that part, I would have my patient stand up and I would have them balance on one leg. All right. So just like that. And then test both sides just in case. Okay, you can sit. And then for cochlear, that's a little bit more inside the ear. So what I would have them do, that's the sensory part. So if they can hear, I'm gonna have him close his eyes, and then I will be like snapping my fingers or clapping in either ear. I'll stand behind him, have him close his eyes, And then I'm going to have him tell me which ear he thinks that I'm snapping in.
Right, left, 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 right.
There we go. Then we have cranial nerve 9, so the glossopharyngeal nerve. This one's another mixed nerve, controls motor and sensory. So motor is swallowing. So you can have them, swallow their spit, or, well, like I said, we don't want to put anything in their mouth just in case there is something wrong with this nerve because we don't want them to choke. So I'd have him try to swallow, and I'd be watching for his Adam's apple to move. All right. Then for the sensory part of that, we have taste on the anterior third of the tongue, so the very tip of the tongue. And then that could also have been tested with the other nerve that had to do with taste. So this one also goes with the gag reflex. So if when they you can have them open their mouth wide and then say ah, and then you can watch their uvula and make sure that it moves. Then we have the vagus nerve, also a mixed nerve. So for sensory, hold on, guys. All right, sorry about that, guys. So we have the vagus nerve, cranial nerve 10. Again, that's a mixed nerve. So for sensory, the sensory part of it, it can also be controlling of taste and then that swallowing. But then for the motor part of it, it's pretty much the controls, sends the signals from the brain to all of your internal organs, your heart, your lungs, all of those things, as well as the throat for swallowing. So when I had him do the ah, right, I was also looking at his uvula to make sure that it wasn't deviating to one side. So if it was deviating to one side, then that would mean that one of the two branches of the vagus nerve is damaged. Two left. So spinal accessory, cranial nerve 11, is a motor nerve. Is only motor. So this one controls the movement of your sternocleidomastoid, so this muscle in your neck right here, and then your trapezius, as well as the muscles of the soft palate, the pharynx, and the larynx. So you also want to make sure that they can say the word ah when testing the vagus nerve, as well as when testing this one. So for spinal accessory, the big test for that is the shoulder shrug, because that sternocleidomastoid here and those traps are what allows you to elevate your shoulders. So you do the resisted shoulder shrug. I'm just going to put both of my hands on his shoulders and have him shrug his shoulders. And I'm going to push down and make sure he can hold them there. That's it for that. And finally, we have the hypoglossal nerve, cranial nerve 12. Again, that one is also just motor. That one is the muscles of the tongue. So when you go to the doctor and they have you stick your tongue out, move it side to side, they're testing the hypoglossal nerve. So for that one, I'm going to have him stick his tongue straight out. And I'm making sure that his tongue isn't going from one side to the other when he initially sticks his tongue out, but then I'm going to tell him to move his tongue to either side to make sure that there's not any deficits in that motion either. All right, so there you have it, the 12 cranial nerves. I will repeat them. It is olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory or spinal accessory, and hypoglossal. So don't forget that those all have, they can either be sensory, they can be motor, or they can be both. All right, and when testing the ones that are both, we test both parts, the sensory and the motor part. All right, so if you guys have any questions, feel free to email me or your instructor if that's not me, and good luck.